Hello guys, so now we shall be discussing the topic of pharynx. Now whenever you discuss about pharynx, first of all let us start. What is this pharynx? Pharynx is nothing but it is a muscular tube, okay, that connects the oral cavity and the nasal cavity down to the esophagus, okay. Right, so what is the pharynx? Pharynx is nothing but a muscular tube. You see the oral cavity here and you see the nasal cavity. The oral cavity and the nasal cavity down here, they are continuous with the esophagus as well as your larynx. Yes or no? Pharynx is continuous with the larynx, right? Your oral cavity is in continuous with the esophagus. So your oral cavity as well as the nasal cavity, both of them are continuous with the pharynx, are continuous with the larynx and the esophagus. So the tube that is connecting the oral and the nasal cavity with the esophagus as well as the larynx is called as your pharynx. So pharynx is nothing but the muscular tube. So this is the muscular tube that connects, oral cavity and nasal cavity. Right, it is a muscular tube that connects oral cavity and nasal cavity to the larynx and the esophagus. To the larynx as well as the esophagus. So that is what is called as your pharynx. Now where is this pharynx present? So pharynx starts all the way from the base of the skull till the inferior border of C6. Okay, I'll show you in the pictures. So pharynx starts all the way from the base of the skull till the inferior border of C6. Inferior border of C6. Okay. So basically we have got three different parts. Basically within the pharynx we have got three different parts. What are those three different parts? One is called as your nasopharynx. Okay. After that we have got something called as oropharynx. Nasopharynx, we have got oropharynx, and finally we have got laryngopharynx. So three important things: nasopharynx, oropharynx as well as laryngopharynx, right? So just look at this particular picture over here. Now in this picture, what are the important things you can see? This yellow color one is called as your nasopharynx. The green color one is called as your oropharynx, and down here it is laryngopharynx. Okay. So what did I tell you? I told you pharynx ranges all the way from the base of the skull. Where is the base of the skull? See, this is your base of the skull. See, this part over here is your base of the skull. Okay. So all the way from the base of the skull till where? Inferior border of C6. So this is your C6. Okay. So till the inferior border of C6. So this is how the pharynx is arranged. Now the first important thing we shall be discussing right now will be regarding the nasopharynx, then we shall go subsequently onto the oropharynx and laryngopharynx. So first let us discuss about nasopharynx. Now coming to this topic of nasopharynx, first important thing you need to know, where is nasopharynx located? Nasopharynx is located at the base of the skull and soft palate. Okay, so where is the base of the skull? See, again I am drawing it, just look at this picture. Where is the base of the skull and where is the soft palate, you have to see. See, this is the base of the skull. See, this particular thing is the base of the skull, and what is this? You see the soft palate over here, this is your soft palate. So between the base of the skull and soft palate, whatever pharynx you have got, that is called as a nasopharynx. So nasopharynx is present between base of the skull and soft palate. Base of the skull and soft palate you have got is a nasopharynx. Now second important thing is that this particular nasopharynx is having what kind of epithelium? It is having pseudostratified ciliated columnar epithelium. It is having ciliated pseudostratified columnar epithelium. It is having pseudostratified ciliated columnar epithelium. Okay. Next important thing is that what are the structures that are located posterior-superior to this? What do you mean by posterior-superior? See, this is your nasopharynx, right? So this is your nasopharynx. So posterior-superior in the sense, see, this is postero and this is superior. Exactly here, what do you have? You have got a pair of tonsils here. These are called as adenoid tonsils. Okay. So posterior-superiorly, we have got adenoid tonsils. So posterior-superiorly, we have got what kind of tonsils? We have got adenoid tonsils, right? Usually you need to know one very important thing, that at the age of 3 to 8 years, the adenoid tonsils, they grow in size, right? And after that, after 8 years, slowly they regress in size. Okay. So this peak growth is seen at the age of 3 to 8 years. Between 3 to 8 years, and after 10 years and all, slowly these adenoid tonsils, they start to descend down. Okay, they start to regress. Now these are some of the important things which you need to know regarding the nasopharynx, right? So what are the things we discussed? Nasopharynx ranges all the way from the base of the skull till the soft palate. Lined by what epithelium? It is lined by pseudostratified columnar epithelium, right? Next, posterior-superiorly, we have got the adenoid tonsils, right? Now next important thing is regarding the oropharynx. So but before we discuss oropharynx, let me create some kind of gap here, so that I wanted to draw one picture and explain you one very important thing. Right. So regarding this oropharynx, one very important thing here is that oropharynx. Okay. So first of all, you have to know where this oropharynx is present. So where is this oropharynx present? Oropharynx is present at the base of the soft palate, all the way from the soft palate, and at the superior border of the epiglottis. You see, this particular structure is called as your epiglottis. Yeah, you see, this particular structure is called as your epiglottis, right? So along the superior border of the epiglottis, so it is located between the base of the soft palate, right, or the posterior most part or the terminal part of the soft palate, till the superior surface of the epiglottis. So till here, soft palate and epiglottis, between these two, we have got this oropharynx. Okay. Let us see how does the oropharynx look and what are the structures. When you open the mouth, can you look at the oropharynx? Yes. So let us see what are the structures that are located within this oropharynx. Okay. Now before that, what we have to do is that we have to create a picture here. All of you just look. See, this pharynx, whatever I am drawing here, this is called as your oropharynx. And all of you know that this is your tongue like this. Okay, so if I am dividing the tongue, so this part of the tongue is called as a posterior surface of the tongue. See, this one, this is called as a posterior 1/3 of the tongue, right? Now next important thing is from the tongue border, you have got one more structure like this, and you have got another structure in this way. Now let us discuss what are these structures, and here also you have got one more structure. This is called as your soft palate. So this is the exact structure when you open the mouth. When you open the tongue out, when you open the mouth, this is how the structure looks. For example, let me shade this area. See, this part of the area, this part of the oropharynx, whatever you can see, right? This is called as your soft palate. What kind of palate is this? This is called as your soft palate. So right now, what are you discussing? Right now, I wanted to discuss what are the structures that are surrounding the oropharynx. By the way, where is the oropharynx? See, this center part, the center white part is called as your oropharynx. So this is your oropharynx. So let us see what are the structures that are surrounding this oropharynx. First structure which we discussed was your soft palate, right? Now, after this soft palate, this arch which you can see inside, the inner arch which you can see over here, is called as palatopharyngeal arch. This is called as palatopharyngeal arch, right? Next, the arch which is present outside, this is called as palatoglossal arch. So two arches we have got. One is called as palatopharyngeal arch, another one is called as palatoglossal arch. Next, Next important thing is that here you have got this tonsil like thing, right, that is located between palatopharyngeal and palatoglossal. So this particular tonsil which you can see over here is called as your palatine tonsil. Okay, so this particular tonsil over here is called as your palatine tonsil. This is called as your palatine tonsil over here. So palatopharyngeal arch, palatoglossal arch and palatine tonsil. Next important thing is that here you have got some tonsils on the posterior surface of your tongue. So these tonsils which are located on the posterior surface of your tongue are nothing but called as your lingual tonsils. So these are nothing but called as your lingual tonsils. Okay, so this is nothing but called as your lingual tonsils. So if I ask you what are the structures that are surrounding the oropharynx, what will you tell? The first important structure is your soft palate. Then you have got the palatopharyngeal arch, then the palatine tonsil, then the palatoglossal arch and the lingual tonsil. So these are the structures you see. These are the structures that are completely surrounding your oropharynx, right? Now, second important thing over here is that within the oropharynx, you have got number of tonsils. Okay. For example, let us say, if you look at the, if I open the mouth, right? Back there, you can look at few tonsils, right? But let us say, what are the tonsils that are located in the pharynx? I mean, in the oropharynx, what are the different tonsils are located? For example, down in the sense anteriorly, you have got tonsil called as lingual tonsils. Just now I have shown you. Lingual tonsil. So where is this lingual tonsil located? This lingual tonsil is located anteriorly. Anteriorly you have got the lingual tonsil. Next, back side, right? So for example, if I am like this, anteriorly in the sense here, right? Posteriorly in the sense back, okay? Laterally in the sense here. So anteriorly, posteriorly and laterally. So anteriorly I have got lingual tonsils. On the back of the pharynx, there I have got a tonsil called as pharyngeal tonsil. There I have got a tonsil called as pharyngeal tonsil, which is also called as a adenoid, which is also called as your adenoids, right? Next, so where is this tonsil located? This tonsil is located posteriorly. Posteriorly, okay? Next, on the side of the lingual tonsils, we have got two more tonsils. These are called as palatine tonsils. So one right palatine tonsil we have got, okay? Another one is the left palatine tonsil we have got, palatine tonsil, right and left palatine tonsil. Next, just above this palatine tonsils, we even have got tubal tonsils. So tubal tonsils on the right, here we have got a tubal tonsil on the left. Now, how will you describe these tonsils? How will you describe is that, for example, if I am drawing a line over here, now can I tell these tonsils, these palatine tonsils are anterolateral, anterolaterally, right? Here also AL stands for anterolaterally. Now tell me, if pharyngeal tonsil is posterior, then these tubal tonsils are posterolateral, posterolaterally located. Here also posterolaterally located. So anteriorly we have got lingual tonsil, posteriorly we have got pharyngeal tonsil, anterolaterally we have got palatine tonsils and posterolaterally we have got tubal tonsils. Now if you can very closely observe over here that you actually can look at a ring like this, right? Actually you can look at a ring. You see this ring, right? So this ring, whatever you can see on the oropharynx, this is called as Waldeyer's ring. What is this ring called as? This ring is called as Waldeyer's ring. So if they ask you what are the structures that are, what are the different kinds of tonsils that are located in the Waldeyer's ring, so these are the tonsils. So anteriorly we were having lingual tonsil, posteriorly pharyngeal, anterolaterally palatine. This is anterior, this is posterior. These two are anterolateral and these two are posterolateral. This is how the Waldeyer's ring is present in the oropharynx, right? Third important thing we shall be discussing is laryngopharynx. Laryngopharynx. Now, when it comes to the laryngopharynx, tell me from where till where the laryngopharynx is located. Look at this. Laryngopharynx is present in the superior border of epiglottis. Where is the superior border of epiglottis? Where is epiglottis first of all? See here. This thin plate like thing is called as a cartilage, is called as epiglottis. So this blue line is starting from where? You see, the blue line starts from the superior border of epiglottis. Okay, so this is from where the blue line starts. And where does it coming down? Where is it coming down? All the way till the cricoid cartilage. You see, this is cricoid cartilage till the lower inferior border of cricoid cartilage. So epiglottis superior border till the cricoid cartilage inferior border. Okay, superior border of epiglottis till the inferior border of cricoid cartilage. This is the place where we have the laryngopharynx. Okay, so this is the place where we have the laryngopharynx. Now, within this, let me write down the laryngopharynx over here. Located all the way from the superior border of epiglottis, and inferior border of your cricoid cartilage. Inferior border of your cricoid cartilage. Now let us see what are the different kinds of muscles that are located within this larynx. Right? So the muscles, if you look at the muscles of the larynx are divided into two groups. One group of muscles are called as circular muscles, another group of muscles are called as longitudinal muscles. First of all, let us write down the names of these muscles and then let us look it in the picture. Okay, coming to the circular muscles, there are three circular muscles. What are these three circular muscles called as? Pharyngeal constrictors. One is called as a superior pharyngeal constrictor. Another one is called as your middle pharyngeal constrictor, and the third one is called as your inferior pharyngeal constrictor. Okay, we have got three important pharyngeal constrictors over here: superior, middle, as well as the inferior pharyngeal constrictor. Coming to the longitudinal muscles also, we have got three important longitudinal muscles. One is called as the stylopharynges. Another one is called as a palatopharynges. And third one is called as a sulpingopharynges. So what are the three muscles? Stylopharynges, palatopharynges, and sulpingopharynges. Okay, so what is the use of all these three muscles? All these three muscles are responsible to elevate the larynx during swallowing. When you are swallowing, the larynx should be elevated, right? So they elevate the larynx during swallowing. Okay, they elevate the larynx during swallowing. Now, first we shall discuss about superior pharyngeal constrictor, middle, as well as the inferior pharyngeal constrictor. Okay, now just look at this picture. Here, I'm just showing you where are these muscles, but I will draw these muscles. Okay, see, superior constrictor, middle constrictor, and inferior constrictor. We have discussed about the superior, middle, as well as inferior. These are the three constrictors over here, right? Now, if you look at this picture over here, right, there is nothing to worry about this picture. So here, this is a cut section of your mandible. And this is called as your hyoid bone. And this is your thyroid cartilage. And here you have got your cricoid bone. Okay, so these are the structures which you can see over here. Now, in these structures, first important thing is that we will discuss superior constrictor, middle constrictor, and inferior constrictor. But before that, you should know what are the different parts of superior constrictor, what are the different parts of middle constrictor, and what are the different parts of inferior pharyngeal constrictor. Okay, so first of all, you see this particular muscle here, right? What is this particular muscle? See, all the way from the pterygoid region, right, from the pterygoid bone, all the way it is going and attaching to the pharynx. So this muscle is called as pterygopharyngeal muscle. This muscle is called as pterygo. Let me write it in the front itself, it would be easy. See, this muscle is called as pterygopharyngeal muscle. Okay, this muscle is called pterygopharyngeal muscle. After that, you see another muscle down here. This muscle is called as buccopharyngeal muscle. So pterygopharyngeal muscle, next is your buccopharyngeal muscle. After that, this part of the muscle which you can see over here, this is called as myelopharyngeal muscle. Myelopharyngeal muscle. After myelopharyngeal muscle, the last part which you can see here is called as a glossopharyngeal muscle. Glossopharyngeal muscle. So how many muscles we have discussed? One is called as a pterygopharyngeal, second is called as a buccopharyngeal, third is called as a myelopharyngeal, and fourth is called as a glossopharyngeal. So all these four muscles which we discuss now, all these four muscles here, right? All of you just look at the arrow now. All these four muscles together, you call them, together are the parts of the superior pharyngeal constrictor. Superior pharyngeal constrictor. All these are the parts of the superior pharyngeal constrictor. Okay. Now, when you go down, you see this green color line. This green color line which you can see over here, right? So this green color line is attached to one side to the pterygoid process and all the way pterygoid bone and all the way down till the mandible. This is called as pterygomandibular raphe. This is called as pterygomandibular raphe. This is called pterygomandibular raphe. And next, all the way from the styloid process, you see this is your styloid process. All the way from the styloid process, you see a ligament that is attached to the hyoid. So can I call this ligament as stylohyoid ligament? This is called as stylohyoid ligament. Stylohyoid ligament. Okay. Now, backside here, you have got few muscles. What are these two muscles? See, this muscle over here is called as chondropharyngeus. This is called as chondropharyngeus muscle, and this one is called as ceratopharyngeus muscle. One is called as chondropharyngeus, another one is called as ceratopharyngeus. So both of these together are the parts of the middle pharyngeal constrictor, the middle constrictor muscle. Okay, so how many constrictor muscles we have got? We have got the superior pharyngeal constrictor, and the next one now we are writing is the middle pharyngeal constrictor. There are two parts. One is called as a chondropharyngeal, another one is called as ceratopharyngeus. Okay, and final and the important thing is down here also you have got two more muscles. See here, this particular muscle over here is called as thyropharyngeus. Why? Because it is attached all the way from the thyroid cartilage to the pharyngeal region, right? So that is why you call it as thyropharyngeus. So another muscle attached all the way from the cricoid to the pharyngeal region is called as cricopharyngeus. Cricopharyngeus. So thyropharyngeus and cricopharyngeus together they form the inferior pharyngeal constrictor. Inferior pharyngeal constrictor, inferior pharyngeal constrictor, right? Now between two muscles, thyropharyngeus and cricopharyngeus, you see this part is completely a defective region. It is not having any muscle. So can I tell wherever the muscle is there, that is the strongest part, and wherever there is no muscle, that is called as the weakest part. So this part which you can see over here, this part which you can see over here is called as Killian's triangle. This is called as Killian's triangle. Okay, or you can also call it as Jenker diverticula. Why are you calling it as Jenker diverticula? Triangle name is Killian's triangle, but sometimes what can happen is that there can be outward protrusion at this region, right, which I would discuss it later on. See, there is an outward protrusion of the contents. So this is called as diverticula. This diverticula is called as a Jenker diverticula. Okay, so what are the important structures which we have discussed over here, guys? So what are the important things which we have discussed over here? We discussed starting on with the nasopharynx. I told you there are three types of pharynx. One is called nasopharynx, next comes the oropharynx, next comes the laryngopharynx. Okay, so coming to the nasopharynx, nasopharynx is all the way from the base of the skull till the soft palate. Till there it is a nasopharynx. And from the soft palate till the epiglottis, that is called as a oropharynx. Next, from the epiglottis all the way till the lower border of the cricoid cartilage, that is called as a laryngopharynx, right? So there are three types of pharynx. So these are some of the important things which we discussed here regarding the pharynx. So thank you so much for watching my video. Goodbye.